Chronic obstructive pulmonary disease. Quick facts for COPD. COPD, or chronic obstructive pulmonary disease, concerns about the constriction of the human respiratory system, leading to difficulty of breathing. It is a progressive lung disease that can be treated but not cured. Synonyms are obstructive lung disease, chronic bronchitis, emphysema, damaged alveoli, weakened air sacs, chronic obstructive pulmonary disease. And COPD is short for chronic obstructive pulmonary disease.
Now let us trace the pathophysiology of the COPD. So COPD is characterized by the airflow obstruction, which is caused by the chronic bronchitis and emphysema. The obstruction is caused by the inflammation, which changes the structural function of the lungs that makes it hard to expire carbon dioxide. The air becomes trapped, causing the lungs to hyperexpand and become barrel-shaped. This prevents air from being expired. Because of the decreased expiration, the patient will become hypercapnic and hypoxic. The excess pressure can further damage the alveoli. Thus, the alveoli sac loses its elasticity. Therefore, there is an inability of the alveoli to fully exhale.
For emphysema, also known as the pink puffers, its signs and symptoms include hyperinflammation of the lungs, also known as the barrel chest, weight loss or burning a lot of calories from breathing a lot, shortness of breath, and severe dyspnea. For chronic bronchitis, also known as the blue bloaters, its signs and symptoms include overweight, cyanosis, hypoxemia, peripheral edema, bronchi and wheezing, and chronic cough. Emphysema results when the alveoli are destroyed, usually because of cigarette smoking or some other chemical that is inhaled. The alveoli are small sacs located at the end of the respiratory tree and where the exchange of oxygen and carbon monoxide takes place. Once the alveoli are destroyed, they cannot be repaired. They lose their elasticity, which causes air to become trapped inside them. This explains why exhaling is difficult for a person with emphysema, and the damage progressively worsens over time. Chronic bronchitis is an inflammation of the lining of the bronchial tubes. Bronchial tubes carry air into and out of the lungs. Mucus forms when the airways are irritated and inflamed. This mucus makes it harder to breathe. The body does not take in enough oxygen, resulting in cyanosis. This causes an increased strain on the heart, eventually leading to right-sided heart failure and edema. Other symptoms include cough, most commonly with mucus, chest tightness, and wheezing. It is developed as a long-term exposure to irritants such as smoke, chemical fumes, and dust. Most symptoms show after the age of 40 when the disease is already in its advanced stage.
What are the risk factors for COPD? First is the tobacco smoking. Tobacco smoking is accountable for at least 90% of COPD cases around the world, and it is the most common factor. Next is the occupation exposure. Dust, vapor, irritants, and other chemicals such as fuels and fumes can harm our lungs. So if you are working in these harsh conditions, make sure you are wearing a protective equipment. Next is the genetics has been implicated in small number of cases. Genetic abnormalities alpha-1 antitrypsin deficiency or the AAT deficiency has been shown to increase the risk for COPD and other lung diseases. Next is asthma. Asthma can be secondary to COPD or will contribute to the progression of COPD. Infection. Recurrent infection in childhood are linked to reduced function. And air pollution. In urban area, air pollution like coal and biomass fuels used for heating can harm our lungs. So make sure you are wearing a personal protective equipment or a mask. So in terms of age of onset, it takes several years for COPD to develop. Most people are at least 40 years old when symptoms of COPD first appear. And it is not impossible to develop COPD as a young adult, but it is likely to be rare. So how do we diagnose COPD? COPD is diagnosed based on symptoms, history of exposure to irritants, and lung function test. The major test for COPD is the spirometry. in which the patient is asked to blow into a tube connected to a machine. A spirometry evaluates the pulmonary functions by measuring the volume and the speed of airflow during the inhalation and exhalation process. There is currently no cure for the chronic obstructive pulmonary disease, but the treatment can help slow the progression of the condition and control the symptoms.
What are the treatment for COPD? First is the smoking cessation. This is the most important thing a patient can do. Chronic obstructive pulmonary disease makes it hard to breathe. Narrowed airways can make cough, wheeze, and feel short of breath. It can affect the activities of daily living, such as basic workouts and walking. Next is airway clearance techniques, hydration, and also long-term oxygenation, if indicated, especially in severe COPD, since it can prevent getting enough air into the lungs. So as a result, oxygen levels in the blood can get too low. Next is exercise plan, especially walking and exercise of the upper body. Here are the pharmacological treatment for COPD. First, short-acting and long-acting bronchodilators. These medications work quickly to relax the muscles around the airways and ease symptoms like coughing and shortness of breath. These include Symbicort, albuterol, albuterol sulfate, and levalbuterol. Next is corticosteroids. These bring down swelling in the airways. The medication is usually inhaled through an inhaler. Inhaled steroids can help relieve symptoms of COPD. These steroid medications include the prednisone, hydrocortisone, prednisolone, and dexamethasone. So, basically, the order of events of the medications is first our bronchodilators, in which it dilates the airways. Then our corticosteroids, in which, after the airways are open, it is time for the corticosteroids to decrease the inflammation.
For the surgical treatment, it includes lung volume reduction surgery, bulectomy, and lung transplant. Other treatment includes pulmonary rehabilitation. Pulmonary rehab is a program to help manage COPD. It can ease shortness of breath, help you exercise more easily, and improve your quality of life. At a hospital or clinic, you'll work with a team of doctors, nurses, dietitians, physical therapists, and respiratory therapists. This includes breathing exercise, nutritional therapy, smoking counseling, and tracking. For lifestyle changes, treatment from your doctor is just one part of COPD care. A few changes to your daily life can also help you breathe easier. Once you've quit smoking, try to stay away from anyone else who smokes. Avoid pollutants like dust and chemical fumes. For the prevention, stay up to date on vaccines such as influenza and pneumococcal vaccine. This decreases the incidence of pneumonia.